As CEO, I have the privilege of reporting to you on the organization's accomplishments this past year and to provide a glimpse into what lies ahead. Without the input and support of hundreds of members and a dedicated staff team, I would not be able to report such success. The board has directed the organization to raise the profile and expand leadership opportunities for this profession. Our public websites, the annual Nutrition Month campaign, the media spokespeople and awards programs, and advocacy all contribute. The internet is the leading source of food and nutrition information for Canadians. That's why we emphasize delivering evidence-based content on our popular websites. We use our social media accounts to amplify our voice. And year over year, we see an increase in engagement on our websites and social media. Leading organizations help us raise our voice by sharing our advice and resources through links to our website. You too can help by linking DC to your organization's website, your personal website, and through social media. All these help make dietitians more accessible on the internet. We aspire to hold our website's top-tier position for nutrition information in Canada. This demands keeping up with the times. When our data showed that 35% of visitors were using a mobile device to access our information, we redesigned Dietitians.ca to better suit smartphones and tablets. A robust multimedia plan featuring, for example, a new bilingual Eat Tracker app, an Eat Right Ontario Kids recipe contest, enhanced content in Cookspiration, and a new member blog badge program have all helped to keep our sites fresh and draw more attention to dietitians. Strong member engagement gave the profession a voice on issues important to Canadians, such as food insecurity, malnutrition in our hospitals and long-term care, the need to use evidence to set vitamin D requirements, and school nutrition. We spoke up as an expert witness to the Senate committee studying childhood obesity. We spoke up during the federal budget consultation, and we spoke up on infant feeding guidelines. And we're working with health coalitions to speak out on key issues leading into the federal election. We joined the Minister of Health at the launch of the nutrition label consultation, and with the input of several hundred members, we offered the dietitian's view on the proposed nutrition label. Nutrition Month lifts awareness of the profession, and every year Nutrition Month has more reach, more impact.
March is Nutrition Month.
Nutrition Month.
National Nutrition Month.
And the Dietitians of Canada.
Dietitians of Canada.
Dietitians across Canada are inspiring Canadians with solutions to some of the common challenges that occur with eating 9 to 5.
According to an Ipsos Reid poll conducted for Dietitians of Canada,
Almost half of Canadians admit eating healthy meals and snacks while at work is challenging.
They end up overeating.
Viewers are loving these recipes.
Cooked or canned lentils.
Berry breakfast parfait.
There's a free app called Cookspiration.
Cookspiration.
Eat Tipster, Eat Tracker.
And there are a lot more tips for eating healthy during the workday.
You can go to the Dietitians of Canada website, which is
Dietitians.ca.
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 What better way to say thank you to your peers than with 30 awards profiling member leaders? This year we received almost 70 peer nominations. Well done! In just 12 months, 16 new media spokespeople helped us deliver almost 600 stories with a media reach of 288 million, and that's in addition to Nutrition Month. Thank you for this big boost for the leadership profile of dietitians. Really well done. We told our stories with 25 news releases. For example, the Fresh from the Farm story, about 165,000 pounds of fresh local produce sold to raise funds for participating schools. The board expects to see increased status of the profession globally as a result of our efforts, and we have contributed through more than a dozen varied leadership initiatives. Looking forward, Canada will have a strong presence in the International Congress of Dietetics to be held in Granada, Spain, September 7th through 10th in 2016. Our plan is to award travel grants to help 35 members share their work at this quadrennial event. We contributed the French translation of the nutrition care process terminology to the International Standardized Language System. We held prominent positions as the Secretariat and on the Board of Directors of the International Confederation of Dietetic Associations, which provided opportunities to deliver plenary lectures about international collaboration in Japan and at the Asian Congress of Nutrition and Dietetics. We raised awareness of international standards in dietetics education and good practice in a lead role for a nutrition and health industry conference delivered with the government of China. This year, dietetics associations around the world work together to raise the profile of the profession by providing a view of how dietetics contributes to solving the big issues facing societies. We began with World Water Day, and our efforts will continue through World Food Day. Dietitians of Canada will lead key messages development for the International Year of Pulses in 2016. In just 10 years, practice-based evidence in nutrition has grown to be a key decision support tool for dietitians. PEN was launched in 2005 with 13 knowledge pathways. Today, PEN is robust, with almost 200 up-to-date pathways populated with thousands of resources to support your evidence-based practice. For example, Eat Right Ontario data shows that PEN has information to answer 95% of inquiries received from its about 20,000 contacts over the year. In 2009, we boldly embraced PEN as a global resource. Today, PEN Global National Association partners and affiliates span the United Kingdom, Australia, New Zealand, Japan, South Africa, and Ireland. Collaboration has exponentially increased the users and resource base needed for this leading, sustainable, global resource for up-to-date, evidence-based nutrition practice. This past year alone, 8 international teams have been collaborating to update assigned PEN pathways. We have seen continuous growth in the influence of the PEN system in dietetics education in Canada and other countries such as Sweden and Switzerland. PEN at 10 has made it easy for dietitians to put evidence-based information into the hands of clients through customizable, culturally appropriate handouts and with 25 new videos. Just imagine PEN at 20.
It has really set us apart as being the profession that has all the evidence to deal with all the nutrition issues. That we've really created something powerful and something that's actually magic and the envy of all the other professions.
We offered 39 professional development events across Canada that satisfied the expectation of nearly 4,000 who have attended. Let's hear from members about the value of networks and conferences in support of their practice.
Hi everyone, my name is Andrea Meller. I'm a consulting dietitian from Whitby, Ontario. One of the things I value most about Dietitians of Canada are the professional networks. Networks allow us to share ideas, resources, and tools to help us stay connected in the profession.
Bonjour, nous sommes Geneviève Grenier
et Isabelle Giroux
du programme de nutrition de l'Université d'Ottawa. Nous apprécions l'opportunité
de venir à la conférence pour réseauter à chaque année.
Just over 2,700 registrations were received for online learning products. Members who chose the All Access Pass got a bargain for 260 products, including 67 new ones added over the year. We launched 3 new online courses: counseling skills, public health dietetics competencies, and drug-nutrient interactions. As promised, we moved forward with developing advanced level certificate courses by defining advanced level competencies in 2 areas. The first certificate courses for dysphagia management will be released this fall. In addition, we will deliver our first interprofessional conference on dysphagia management, as well as continue the very popular obesity retreat and sports nutrition course. We rely on members to put forth ideas for planning professional development events and online learning. Nearly 150 proposals were received for this year's national conference. And member input has paid off with high satisfaction for all our professional development programs. The board has placed a priority on effective collaboration with dietetics educators and dietetics regulatory bodies. And together, as the Partnership for Dietetic Education and Practice, we completed new dietetics education program accreditation standards. We are pleased to report implementation is well underway. We provided a forum for an annual dietetic educators meeting, and last year more than 60 participants shared innovations and discussed issues in dietetics education. This year, dietetics educators are focusing on next steps to Vision 2020. Our online courses and PEN help educators with their job of helping students develop dietetic competencies in the majority of dietetic education and training programs. Creating opportunities to increase access to dietitians is another priority of Dietitians of Canada. For example, the Consulting Network and a British Columbia local action group are advocating for increased access to dietitian services in employee extended healthcare plans. We met with the Treasury Board of Canada to advocate for inclusion of dietitian services in the Public Service Healthcare Plan.
My name is Nicole Osinga, and I'm a registered dietitian in Oshawa, Ontario. My favorite DC product is the Are You Covered infographic, which is used as a tool to communicate the value of dietitian services to employee health insurance plans.
In our 8th year of delivering Eat Right Ontario, as funded by the provincial government, our public and health professional clients could not be more satisfied. We continue to use our operational experience to advocate for dietitian contact centers in more provinces, including Saskatchewan, Quebec, and Atlantic Canada. Local action in every region has been diverse and oriented to local circumstances. BC members worked with the provincial government to ensure regulated health professionals were hired to deliver food and nutrition services. Alberta members advocated for better access for long-term care clients. Northwest Territories dietitians added their voice in budget consultations. Saskatchewan and Manitoba dietitians voiced their concerns on better practices for staffing in long-term care. BC and Ontario promoted the role and contributions of dietitians in primary health care. And Ontario and New Brunswick took advantage of election years to speak up on better access to dietitians. This coming year, we will develop toolkits to better support members in their advocacy efforts to increase access to dietitians. We released a paper on the dietitian's role in dysphagia assessment and management and published the executive summary in an issue of the journal. This position, together with professional development, support better access to dietitians for patients with swallowing disorders. Through our operations, we continue to support the fundraising and knowledge transfer efforts of the Canadian Foundation for Dietetic Research. I am calling on every member to help CFDR make a difference for us. Take a moment to think about how CFDR-funded research enables dietitians to generate the profession's unique body of knowledge a distinguishing trait for any profession. Evidence of the important contributions CFDR makes to the profession can be seen in its annual report. A small contribution from each of 6,000 members can make a big impact. Thank you for all your support. We are stronger together.